Assalamualaikum warahmatullahi wabarakatuh everyone. Today I would like to introduce a genetic condition known as Turner syndrome. Turner syndrome is a disorder that affects only females and occurs when one of the X chromosomes is missing or partially missing. This chromosomal abnormality is commonly represented as 45X or 45XO. As a result, individuals with Turner syndrome may experience several physical and developmental features such as short stature, delayed puberty, infertility, and in some cases, heart defects. Despite these challenges, with proper medical care and support, most individuals with Turner syndrome can live healthy and fulfilling lives. Heart and kidney abnormalities can also occur, making medical monitoring important. Although Turner syndrome is a lifelong condition, early diagnosis and proper treatment can significantly improve quality of life. Growth hormone therapy can help increase height, while hormone replacement therapy can support the development of secondary sexual characteristics during puberty. Regular medical checkups are also essential to monitor heart health and other possible complications. Turner syndrome is usually diagnosed through chromosome analysis, also known as karyotyping, which allows doctors to identify the missing or altered X chromosome. In conclusion, Turner syndrome is a genetic condition that affects females due to a missing or incomplete X chromosome. While it presents certain physical and developmental challenges, with early medical care and support, individuals with Turner syndrome can lead healthy and productive lives. In the next part of my presentation, my friends will discuss the causes, symptom diagnosis and management in more detail. Thank you.
So, what is the genetic mechanism for Turner syndrome? Turner syndrome is caused by the chromosomal non-disjunction that leads to either monosomy X, partial deletion of X chromosome, or mosaicism that leads to the loss of one whole X chromosome or a part of it. The important gene affected is the S-Hox gene on the short arm of the X chromosome, which controls the bone growth and also the height. During meiosis, X chromosome fails to separate properly, or part of it breaks and is lost, which causes missing genetic materials. This will result in only one copy of important genes instead of two. This is a condition called as haplosufficiency. Reduced S-Hox gene expression may lead to impaired bone growth and short stature, which explains why Turner syndrome patients are short in height. Loss of other X-linked genes affects ovarian development, causing straight ovaries, delayed puberty, and also infertility. Missing genes also disrupt normal development of kidneys, heart, and also the lymphatic system.
What is symptom? Symptom is a physical or mental features which is regarded as indicating a condition of disease, particularly such a features that is apparent to the patient. Assalamualaikum, my name is Ainul Akilah, and today I will be presenting the symptom of Turner syndrome. Let's start with the more visible physical characteristic on the left. The first one is facial and head features. Common signs including the droopy eyelids, low set of ears, and a high arched palate. We could also often see a retronetic face and a small chin. The next one is the neck and the torso. One of the hallmark signs is the webbed neck and a broad, shy-like chest with widely spaced nipple. The third one that we could see on a Turner syndrome patient is the skeletal structure, where patients often exhibit short stature. In the limb, there is an increased carrying angle of the forearm that is known as cubitus valgus. Other than that, they also have knobbed knees and a shortened fourth metacarpal bone in the hand. For extremities, we also may notice nail dysplasia, where the nails are small or narrow. Beyond these physical markers, there are several significant internal and developmental challenges that we list on the right. The first one is the developmental. The most common is delayed pubertal development due to ovarian insufficiency. And the second one is the cardiac and renal. Many individuals are born with congenital heart defect, and they mostly suffer from hypertension or frequent urinary tract infection. And the third one is about the sensory and the endocrine. There is an increased risk of chronic ear infection that we call as otitis media, which can lead to hearing loss. Additionally, metabolic issues like hypothyroidism and dyslipidemia are common. In summary, because Turner syndrome affects so many different organs, from the heart to the skeletal system, early diagnosis and a multidisciplinary approach to care are essential for improving the quality of life for this individual. Thank you for your time.
Now, I will explain how Turner syndrome is diagnosed. Firstly, diagnosis begins with clinical evaluation. Doctors observe physical and developmental characteristics of the patient. Common features include short stature, webbed neck, and a broad chest. Patients may also experience puberty, infertility, and a swelling of the hand or feet known as lymphedema. Secondly, karyotype analysis. This is the standard test for diagnosing Turner syndrome. It involves examining the chromosome in a blood sample. The most common result is 45X, which means one of X chromosome is missing. Some patients may have mosaicism, such as 45X or 46XX. Thirdly, Turner syndrome can be diagnosed prenatally. During pregnancy, ultrasound can detect abnormalities such as cystic hygroma or increased nuchal translucency. Further information can be done through amniocentesis or chorionic villus sampling. In addition, NIPT can be used as early screening method. Lastly, hormonal and supportive tests. Hormone tests usually show increase in FSH and LH level with low estrogen level. Doctor also examine heart and kidney as abnormalities in Turner syndrome.
For this part, I will explain about the management and the intervention for Turner syndrome. Turner syndrome is a genetic condition that affects females and often causes short stature, delayed puberty, infertility, and increase in health risks. For management, it focuses on improving growth, hormonal balance, bone health, and reproductive outcome. Okay, first, I will explain about the hormone therapy. Growth hormone therapy is given during childhood to help increase their height and improve their overall physical growth, as individuals with Turner syndrome are usually shorter than average. Okay, next is the estrogen and progesterone therapy. Estrogen is used during adolescence to promote breast development, initiate puberty, and support their bone health. For progesterone, it's later added to regulate menstrual cycle and protect their uterus. The third management is involving bone health. Individuals with Turner syndrome have a higher risk or chance on getting weak bones due to low estrogen levels. Therefore, adequate intakes of calcium and vitamin D is very important to maintain strong bones and prevent fractures. And the last management is fertility and reproductive health. Most individuals with Turner syndrome often experience infertility. However, pregnancy is possible with the help of assisted reproductive technology, or known as ART. And the most common method is in vitro fertilization, or known as IVF, by using donor oocyte. The last one is before pregnancy, a pre-pregnancy cardiac assessment is essential. This is because Turner syndrome is often associated with heart abnormality, and pregnancy may increase cardiovascular risk. A thorough heart evaluation help to ensure the safety of both mother and the baby.